Hello everyone. Today I would like to present our research work titled Examining the Validity of an Endoscopist-patient Co-participative Virtual Reality Method in Pain Relief during Colonoscopy. Colonoscopy is a crucial procedure for the early detection and prevention of colorectal cancer. However, patients experience significant physical pain and negative emotions such as fear and anxiety during the procedure. Although sedation is an option, it carries risks, especially for elderly patients. Therefore, this study focuses on developing a non-pharmacological method using virtual reality to relieve pain during colonoscopy. How can we use VR to reduce pain perception? Previous studies have shown that while VR is effective in distracting patients, many methods only involve passive content, where patients are merely watching VR without actively interacting with it. This approach does not fully engage the patient's attention channels. Furthermore, existing VR methods lack distraction mechanisms with precise triggers. To maximize effectiveness, real-time interventions from the endoscopist are necessary to ensure targeted distraction at optimal moments. This is a key element that has been missing from most existing VR interventions. Our research question is, how to develop an effective VR method to relieve pain during colonoscopy? To answer it, first, we focus on design considerations, which address the challenges and requirements. Second, we propose the EPC-VR framework and construct a prototype system. Finally, we examine the effectiveness of EPC-VR in a real clinical setting. In designing the EPC-VR system, we took several key factors into account, both from theoretical thinking and clinical observations. From theory, we based our approach on the neurocognitive model of attention to pain, which involves both top-down and bottom-up attention mechanisms. Top-down attention involves active participation by the patient, directing their focus, while bottom-up attention captures their attention involuntarily, based on sensory salience in the environment. From clinical investigation, we conducted field observations in the endoscopy room and focus group interviews with endoscopist doctors to understand real-world challenges. Based on this, we identified 4 key design challenges. Challenge 1. We needed to support active interaction with the virtual content, rather than just passive watching, to ensure the patient's attention is fully engaged. Challenge 2. We had to enable endoscopists to precisely trigger the distraction mechanism at the most effective times to maximize its impact. Challenge 3. The VR experience must be suitable for the patient's body posture, as they remain in a left side lying position during colonoscopy. Challenge 4. An objective visual indicator of pain should be included to monitor and determine real-time pain levels. Based on the design considerations, we developed the EPC-VR system, which integrates both the patient and the endoscopist. The system includes several key components. Firstly, the patient uses a hand controller with a thin film pressure sensor to measure grip force, which helps estimate their pain level in real time. The data is sent to a laptop, where it is visualized for the endoscopist. Patient then interacts with a music-based VR game through the Pico VR headset, where objects fly toward them in sync with the music, and the patient must interact with these objects, helping to engage their attention and reduce pain perception. Secondly, the endoscopist uses a separate hand controller to trigger distraction mechanisms during the procedure. This involves real-time visual and auditory changes in the game to capture the patient's attention at critical moments, enhancing pain relief. This system combines real-time pain monitoring with targeted distraction, making it a comprehensive approach to improving pain management during colonoscopy. To evaluate the effectiveness of EPC-VR, we conducted a clinical experiment to test 2 hypotheses. H1, VR with endoscopist involvement will significantly reduce the patient's perceived pain. H2, VR with endoscopist involvement will significantly reduce the patient's fear. The experiment used a between subjects design with 4 conditions. Condition 1, VR with pre-recorded videos. Condition 2, VR without endoscopist participation. Condition 3, VR with endoscopist participation. Control, no VR. 40 patients participated, with 10 per condition. We measured pain perception, grip force, affection, and acceptance of EPC-VR. The experimental procedure involved several steps. First, participants completed a pre-test questionnaire to collect demographic information. Next, they practiced using the VR headset to familiarize themselves with the equipment. During the procedure, we recorded the grip force from the hand controller to monitor real-time pain levels. After the procedure, participants completed a post-test questionnaire to evaluate their experience. Finally, we conducted a brief interview with the participants, followed by compensation for their participation. In terms of pain perception, we analyzed the correlation between grip force measures and the perceived pain levels. The results showed a significant correlation between hand grip force and perceived pain levels. Specifically, the voltage and percentile values of grip force were positively correlated with pain perception, indicating that hand grip force can be an effective indicator for real-time pain assessment. In terms of pain levels across different experimental conditions, the analysis revealed significant differences. The VR with endoscopist participation group reported significantly lower pain levels compared to the control group, supporting our hypothesis. While VR without endoscopist participation and pre-recorded video groups showed marginally lower pain levels than the control group, the differences were not as pronounced. In terms of emotional responses, patients in the VR with endoscopist participation group felt more interested and less scared compared to the control group. VR distraction effectively reduced patients' attention to the medical process and improved their overall experience. Regarding acceptance of EPC-VR, 87.5% of participants would choose to use the VR application for future colonoscopies. Only 7.5% preferred regular colonoscopy without VR, and 5% opted for sedation. Most patients found the VR game distracting and helpful in reducing pain. Additionally, results showed that VR music games helped alleviate negative emotions. In this discussion, we found that grip force correlates with perceived pain, providing an objective measure for pain monitoring during colonoscopy. The co-participative mode, where the endoscopist actively triggers distractions, proved more effective in reducing pain than passive VR methods. Clinically, EPC-VR not only reduced pain but also improved emotional responses. 87.5% of participants preferred VR for future colonoscopies, highlighting its effectiveness over traditional methods. However, the study had limitations such as a small sample size and lack of demographic control. Future studies should involve larger samples and better control over variables. This paper makes the following contributions. First, we propose a framework for EPC-VR, a method integrating the endoscopist and patient to reduce pain during colonoscopy. Second, endoscopist participation is crucial for effectively triggering the distraction mechanism to reduce pain perception. Third, bottom-up distractions reduce patients' focus on the medical environment, increase interest in VR, and alleviate fear. Thank you for listening, and I welcome any questions or discussions.